Hey everyone, thanks for joining us once again in our News West 9 kitchen. Today we have Tyler Collins. He's the epidemiologist with the city of Midland. And I'm so glad you're here today because we're going to talk about a topic that gets a little confusing sometimes. So food poisoning and cross-contamination. So first let's start off with food poisoning for anyone who, because I hear people say, I think I have food poisoning, but what exactly is it and how do they know they have it?
So the most common symptoms of food poisoning are going to be diarrhea, nausea, vomiting, stomach cramps, and a fever. And typically you get that from eating either undercooked food or food that has some sort of contamination, some bacteria that's going to make you sick.
That's one of the, so diarrhea and then vomiting is another one?
Yeah, nausea, and it may just be stomach cramps as
Okay,
well.
so whenever someone is experiencing some of these symptoms, it is vital to have water.
Yes, yeah. So when, in the past, a lot of people that would get, some dysentery or something like this would end up dying, and that was mostly due to dehydration. And now that doesn't happen so much, but it is important that when you have diarrhea or vomiting to drink lots of fluids.
Okay, good to know. All right, and then so who are, what, is there a demographic as far as people who are more than likely to get food poisoning?
Yeah, so there's some high-risk people, pregnant women, kids younger than 5, people 65 and older, and those that are immunocompromised could have more severe sort of outcomes with food poisoning.
Okay, so people with weakened immune systems, and when we're referring to that, how do people know if they even have a weakened immune system?
Yeah, it's going to be like chronic health conditions that most likely they'll have been diagnosed by a doctor, and so should be aware that they need to be a little bit more careful with making sure that their food is thoroughly cooked.
Okay, and so when it comes to food poisoning, I guess, what are one of the top ways that people actually get it?
Yeah, so one of the main ways is through cross-contamination. So bacteria or germs on raw foods can get transferred to other foods, and when people ingest those foods, then it makes them sick. Or if their food is undercooked, that can make them sick as well.
So I know when we think about cross-contamination, it's don't put your raw foods next to this, but it can really be through another way, through, to infect, right? Yeah,
so the main ways to keep safe when cooking your food are through cleaning, separating it, cooking it, and chilling it. And what those mean are clean, you want to make sure your work surface is clean and your hands are clean. So after you've dealt with raw food or poultry or eggs, you want to make sure you wash your hands, wash the area where you were dealing with those. Separating is the same idea. You don't want to, on a cutting board that you use to cut up raw chicken, to turn around and cut up some carrots that you're going to sprinkle on top of the salad, because then those carrots have all the germs from that raw chicken. And then cooking it, you want to make sure you get your food to the appropriate temperatures. And then chilling it is also important. Sometimes people will leave their food out after they've cooked it, but there's temperature ranges in there that can cause bacteria to grow pretty rapidly. And so after you've cooked your food and you're ready to put it away, you need to make sure that you put it in the refrigerator pretty quickly.
Okay, very good. So when it comes to different types of illnesses that you can get from cross-contamination, I know one of the things that I think about is salmonella, but are there others too?
So the main bacteria that people see when that people have when they have food poisoning are going to be salmonella, campylobacter, norovirus, and E. coli. And so they can get these basically through consuming undercooked food or consuming food that's been cross-contaminated with raw meat or chicken or eggs.
You know how when people have food and they leave it out on the counter, let's say if it's already cooked chicken, is that bad?
Yes, so
Okay.
it depends on how long you leave it out. You don't want to leave it out too long. If you're, if you finished cooking it and you need to prep other stuff, that's fine. Or you can leave it sort of simmering to keep the temperature up on it. But, after you've eaten, you don't want to leave it out for an hour, 2 hours before you refrigerate it. And then another thing is too that kind of along with that is when you're thawing your food, you want to thaw it in cool water or in the refrigerator. You don't want to thaw it out just on the counter at room temperature because of the same thing. As it's thawing, it's reaching those temperature ranges that cause the bacteria to rapidly grow.
Wow. So now I need to change how I'm doing things in my kitchen. And then, so when it comes to cooking, what is the best way, I guess the best advice that you can give people when they're actually cooking in the kitchen? Is it just like separating certain foods? And we go back to those 4 steps though, right?
Yeah, so it's those 4 steps. You want to keep them separated, and you want to make sure that if you only have one cutting board that you're using, you can reuse it so long as you wash it. between uses. You don't want to use it or use a knife without rewashing it. The other thing is too, one of the big steps is get a meat thermometer. It's easy to just be like, well, I'll just eyeball it. I know how to cook. But if you want to be safe, if you want to avoid getting sick, no one likes to get sick. A meat thermometer is going to tell you that your food has reached the right temperature range to kill all that bacteria.
Okay, and that's what I do notice with a lot of recipes. They always say check the internal temperature of certain types of meat. Let's say like chicken, for example. What is the right temperature so that someone doesn't get sick as opposed to like steak or whatnot?
So for chicken and turkey, other poultry, you want to get the temperature up to 165 degrees. For ground beef, the temperature is going to be 160. For eggs, it's 160. And then for pork or certain beef, it can be as low as 145, and same for fish. And so when you're reheating leftovers as well, it's important to get those temperatures up when you're microwaving or reheating. Okay. And so you want to get it up to 165. And so the different meats do have different temperatures, but knowing what these temperatures are and keeping a meat thermometer at hand to test those temperatures will make sure that your food is free of bacteria as they've been cooked off.
Okay, and then so there's debate about whether you should wash your raw meat. So what is the correct answer to that?
Yeah, so it's not a good idea to wash your raw meat in the sink. Okay. When you wash it, the water's going to splash everywhere and take the germs and bacteria that was on that meat around your sink, maybe onto your countertops. At least I know me, when I use my sink, it makes a big mess everywhere.
Yeah.
And people don't always think to disinfect and to clean their sink afterwards. And so when you're washing it, you're spreading those germs everywhere. You maybe aren't washing the sink as well as your countertops, and that's going to lead to cross-contamination later. And so you shouldn't really be washing your raw meat in the sink.
Okay, see, we put an end to that debate, so now you guys have the answer to it. And so I heard a rumor. So I mean, when it comes to buying vegetables, like bagged vegetables, is that also another form of cross-contamination if you don't wash it? Yeah,
so if you buy bagged vegetables that are unwashed, you definitely want to make sure that you wash those beforehand. If they are pre-washed, that means that they have been rinsed with a water-chlorine mix. Chlorine is a really good disinfectant. It's actually in our tap water at low levels to kill bacteria that can thrive in water, because a lot of the same bacteria that are in our food are also in our water. And so chlorine, in both cases, rinsing off vegetables and in the water, can help disinfect and kill those bacteria. And so if it's been pre-washed, that's what it typically means, and that means it's safe to eat right out of the bag. If it hasn't been pre-washed, you definitely want to rinse it, scrub the leaves, make sure you get in all the nooks and crannies of the vegetables.
Okay, good. And then so if we can pull up that slide again, whenever people are shopping, let's say they're at the store, you actually have to think about cross-contamination when you're shopping.
Yeah, that's right. Those plastic packages that cover your meat may not always be perfectly sealed. They might get poked or punctured, and then if those juices start leaking out in your shopping bag or your shopping basket, then it's going to get on the outside of other stuff. It might contaminate some of your produce that's there. So yeah, if best you can, you want to keep those raw meats separated from your other produce.
And so even when, like, let's say you're at HEB, you're getting your stuff bagged, it's best to put all the meat in one bag as opposed to mixing everything together.
Yes, yeah, that's correct. And that's typically, what the baggers at those supermarkets will try to do, is keep those things separated.
Okay, very good. And then so what about storing, when it comes to storing your meat or your food or whatever to avoid cross-contamination? What are some steps that people can do for that?
Yeah, so the same thing, you kind of want to keep it separated in the refrigerator. If it's not being frozen and so you're keeping it in the refrigerator to thaw, you might put it on a plate or in a dish in order to make sure that those juices aren't leaking out. You don't want to just set it in there, because then the same thing might happen. Those raw meat juices will get out in your refrigerator and can contaminate other things.
So let's say if you have a barbecue and you have your raw meat, chicken, and then steak, does it matter if you put it in the same container? Do you have to separate them? Yeah, it's best to keep them separate while you're preparing to cook. Once they've been thoroughly cooked, you can store them in the same container, so long as you refrigerate them quickly. But yeah, just best to keep everything separate. You don't want something that was on the raw meat or raw beef getting on your chicken and vice versa. Okay. Another debate I wanted to talk about is when people put their utensils face up in the dishwasher as opposed to face down. And when we talk about cross-contamination, does it matter which side it goes or which way it's facing?
Yeah, so the biggest thing is that the soap and the heat of the water in the dishwasher is going to kill off those germs, but people don't always think about they need to wash their hands before they unload their dishwasher, because if their hands are dirty, no matter which way they're grabbing a utensil, they can spread germs to the utensils that way. So washing your hands before you unload the dishwasher is going to make sure that there's no contamination there.
Okay, awesome. And then on average, I'm just curious to know, but do a lot of people here in Midland get tested for food poisoning? I mean, how frequent is it, I guess?
Yeah, so over the last 4 years, we've seen about 80 cases of different types of food poisoning a year. And so that doesn't account for all of the cases. When most people get sick from food poisoning, they might not go get tested. But when they do get tested and it's certain illnesses like salmonella, or if there's a large outbreak of norovirus or it's Campylobacter, those will be reported to us so that we can do an investigation, call them, talk to them, see what they ate, try and determine if there's, a restaurant that is serving undercooked food, or if there's something at the grocery store that might be contaminated. And that way we can keep the cases to a minimum, because though these aren't typically dangerous illnesses all the time, for those people that are at high risk, they can be dangerous. And so these are the most common illnesses that we see and that we have to investigate. So if you are sick with food poisoning, we recommend that you go see your doctor, especially if you have several days of those symptoms.
I think it's interesting that you guys will investigate where some of these cases come from. And I don't mention any businesses, but I assume that there's been cases where you track it back to a certain restaurant, right?
Yeah, and I mean, it is difficult sometimes because the symptoms can, sometimes people will think it maybe just be the most recent place they ate, but the incubation period from when someone ingests the bacteria to when their symptoms start can be as many as 3 days. And so it's not always easy to pinpoint when exactly a person was infected, but, trying is the only way to try and figure that out.
And so that was the other thing I didn't know as far as testing goes, that you can go and get tested, because a lot of people, I've had people who say, I can't come in, I'm feeling sick, I have food poisoning, but the only way to really find out is to get checked.
Yeah, to know exactly what it was that made you sick, and maybe to help determine what food items it was, the only way to know for sure is to go get tested.
Okay, and can they go to you guys to figure that out?
Yeah, well, we don't do testing, but we can, help refer people. And also, if they are feeling ill with food poisoning, whether they've been tested or not, they can contact the health department, and we can, talk to them, see where they might have eaten, whether it's a restaurant that might need an inspection, or food items that seem, particularly notable, and we can help determine maybe the causes of that.
Okay, good. Well, this was so informative, so thank you so much. Was there anything else that you wanted people to know as far as
just those main 4 steps of food safety, just cleaning, separating, cooking, and chilling. Those are the 4 main things that if you remember and you follow those steps, then you should be able to keep yourself and everyone else safe in the kitchen. And the other thing is too, if you are feeling ill with nausea, vomiting, fever, it's probably best not to cook for others, just because you might have one of these bacteria that then you spread while you're cooking if you aren't careful. And so, try not to cook when ill, and also just follow those steps to stay safe.
Okay, well, thank you, Tyler. Thank you so much for joining us today.
Thank you.
I hope you guys learned a lot. Be sure to find some of the other interviews that we've done with the health department on our website, newswest9.com. You can also watch it on 9+. We'll see you guys next time.